Hello and welcome to the program. My name is Marie Yambo and definitely this is Health and Lifestyle, where we talk all matters health. We'd like to hear from you. Go to our social media handles at Marie Yambo at KBC Channel 1 and on Facebook, KBC Channel 1 TV. We'd like to hear your views about the program and even some of the topics that we'd want us to, to bring for you in this particular program.
So this is the kit itself. It is as easy as the way a lady would use a tampon.
Innovative ways for testing cancer.
What cancer does is your normal cells grow and outgrow. They proliferate, grow really, really fast, Imagine like when your tea is boiling and it just flames up. And that growth overwhelms the blood supply, so tissues begin to rot and fall off.
We'll also be talking to Dr. Nelly Mugo. She's a researcher and a scientist at the Kenya Medical Research Institute about HPV, that is actually a preventive measure for cervical cancer. And we'll definitely be giving you health tips on a good practice segment. Now, cervical cancer is sexually transmitted and is the second leading cause of cancer deaths among women in Kenya. Early diagnosis of the human papilloma virus remains the #1 measure to curing the disease, but the challenge of access to screening in health facilities means the disease is often diagnosed late. A home cervical cancer self-collection kit is just not offering women privacy. Medical experts also hope it will help show up the number of women testing for cervical cancer. Let's take a look. It is the 4th most common cancer among women worldwide. Cervical cancer is the 2nd most prevalent in Kenya, trailing only behind breast cancer. However, with 5,200 women dying each year, it is the primary cause of cancer-related deaths in the country, claiming approximately 9 women each day, according to Gavi, the Vaccine Alliance. Early diagnosis of the sexually transmitted human papilloma virus can save lives.
By the time they are noticing that there is something unusual, usually it takes quite a number of years, and that is why I want to talk about the tests, the screening tests that a woman would be interested, should be interested to undertake.
Screening for the virus usually involves a doctor getting samples from the cervix, an uncomfortable exercise for a lot of women. A home self-collection kit is hoped to make it easy for women by giving them privacy.
We have a very good kit that is can be collected by the female. The patient, they don't need to have to, it's not guided by the doctor. So they are very good. It's very easy to use, and the instructions are very easy to use, and you can do it at the comfort of your home and the privacy of your home.
Zanifa Gitari, a medical microbiologist, explains how the kit works.
What you do is, after making sure your hands are clean, you've washed them thoroughly, you remove the casing. Just remove the casing. Don't throw away the casing. So this is the kit itself. It is as easy as the way a lady would use a tampon when they're having their periods. So once your hands are clean, you just want to remove that cap. Just secure it out and put it somewhere in a clean place. And assuming a very comfortable position, the lady now just inserts when it's upright like this, into the vagina, up to the level where you can see these wings, these protrusions like this, and that's where you stop. With this pink part, you just push it in. This is a very, very soft brush that will pop out, and from there, then you can start collecting the sample. And you do this by rotating. You see this pink end, you just rotate it up to 5 times. And for every turn, you're going to hear a click sound, and it will help you to know that you are collecting adequate sample. With this pink thing, you just, the plunger, you just like push it back down, and you can see the brushes disappearing. Avoid touching this area when you're, even before collecting or even after collecting. And then remember the cap, you just put it back. It, you can hear that click sound, and put it back to the casing. Our team will be able to come and pick the sample up from you, or if you're going on your way to work, or you can pass by the path care facility or lab that is near you.
We ensure that we have seen and we have confirmed that is self. We explain to the patient the amount. From there, we indicate to the patient that after she has done the sample, it will reach the facility 1 hour, so that it cannot be malfunction or contaminated or prevent inaccurate data.
Pauline Thome attests to using the home collection kit.
At times, like, you're not comfortable going to the hospital, like somebody else handling you down there, so they're giving you the chance to do it yourself at the comfort of your home. The brush itself is soft, no bristles, and then there is no discomfort since the process itself is not messy.
The question, is there a chance of the patient compromising the sample collected?
If you collect the sample with the instructions given, we'll be able to have adequate material collected, and we can test and we can see that this is the outcome of that test.
And what exactly is the microbiologist looking for during the test?
For the pap smear, they are looking at abnormal cells, and you have to see them. But for this one is the virus, and it exists in that entire cavity. Yeah, up to where this reaches, it can collect the appropriate amount of sample, and we can be able to determine whether there is a DNA of that virus present in the sample.
What remains to be seen is whether this home kit will convince more women like Pauline to test for cervical cancer and hence prevent avoidable deaths.
Prevention is always better than cure, and early diagnosis can really help a great deal.
And while you've had it from the horse's mouth, would you be comfortable using a self-collection kit for cervical cancer diagnosis? Well, that's the question we put across to women in the streets of Nairobi. Let's get to hear what they have to say.
Okay, for me, I'd be open to try it because personally, I get it so hard to go to hospital. I normally go to hospital only when I'm sick, like I cannot take it anymore. But if I can take like Panadol, Sonamoja, I'm okay. But when I'm too sick, I cannot take it anymore. That's when I go to hospital. So for me personally, this will be so beneficial because I don't have to go to hospital. Yeah.
At home is not good because somebody, that person that maybe cannot have the experience. The person is not trained like a doctor or any person from the health, and it's good for that person to go and to have a medical checkup in the hospital.
Actually, given a way to use it, I would, because it will save me time. Because many hospitals have a lot of queue, and you have to have an appointment. So I can use it.
Yes, of course I would, because most of us are very busy, and also there are some women like it's not very comfortable to do it in the hospital. So of course when you do it at home, it's more comfortable, and you can do it often. So I'm not sure how much maybe the kit costs, but if they just charge it less, I'm sure many women will do buy them and do it at home, which is maybe much easier and much more comfortable.
Well, there you have it. Word on the streets. Do share your views on our social media platforms. That is at KBC Channel 1 at Mariam on X, and also on our Facebook page. That is KBC Channel 1 TV. Would like to hear some of your views in as far as the self-collection kit, the home testing kit, or at least collection kit that you've just heard about. Now, there is also a way of preventing cervical cancer, and that is the HPV vaccine. Now, the HPV vaccine against human papillomavirus that causes cervical cancer in women has been shown to be the best method to eradicate cervical cancer. But did you know that HPV can also cause cancer in men? Well, Dr. Nelly Mugo is a Cambridge scientist who has been involved in clinical trials of the HPV vaccine here in Kenya. She explains some of the cancers in men caused by HPV and also assures of the safety of the HPV vaccine for girls aged between 9 and 20 years.
We have oropharyngeal cancers, and oropharyngeal cancers are more common in men than women, but it also causes penile cancer. Penile cancer is rare, but it's terrible, a terribly painful cancer to have. So men also suffer, and warts. I tell people warts won't kill you, but they're not pretty, and they're not nice to have. And those can all be prevented with vaccination.
There is a low uptake of the HPV vaccine among Kenyans, and when I say that, I mean most parents are skeptical about the HPV vaccine. But could you talk to us about the safety and the effectiveness of HPV vaccine?
So the human papilloma vaccine, which was approved and developed way back in 2007, is highly effective. And you know, there's been population demonstrations. Now we have countries who are talking about elimination. Scotland actually published this year, 2024 paper, and they say the cohort of girls they vaccinated 20 years ago, none of them have disease or even pre-cancer lesions. That's a value of that vaccine. Australia, which was also an early adapter, is stopping to see lesions and cancer's gone down. So there's absolutely no doubt about the population impact of HPV vaccination. And so they also have what we call gender-neutral vaccine programs. So not only are the girls vaccinated, but the boys are also vaccinated.
Yes. You have been involved in the research as far as the HPV vaccine is concerned here in Kenya. Maybe you could share with us the outcomes of the study, if any, and what has been your experience in studying the HPV vaccine?
One of our most famous studies, if I can call it that, we call it KENSHI, Kenya Single-Dose HPV Vaccine Efficacy Study. And we enrolled young women ages 15 to 20, and we were asking the question, is one dose enough for protection? Because what we call observational studies is people accidentally got one dose, though they were planned for 2 or 3 doses. And you know, we have data now up to 20 years showing that the single dose cohort was still protected. But in science we say, well, then it could be by chance, because we don't know what the differences are between the ones who got 2 or 3 doses and the ones who received 1 dose. So we conducted a trial with 3 other Cambridge scientists, Dr. Onono, Dr. Betty Njoroge, and Professor Elizabeth Bukusi, and with a colleague who was then at the University of Washington and now is at Harvard, called Ruan Barnabas. And we asked that question, if the young girls got only 1 dose, would they keep them protected? So we ran that study, and the first 3 years we've already presented the data, and that data was used to change recommendation for vaccine dosage by the World Health Organization, because we showed such high protection from the single dose. Extremely high, higher than, you know, measles vaccines and other, up to 99% protection from the vaccine types. So, you know, together now with what I described as observational data and our randomized trial data, then it became really robust evidence. And the World Health Organization reviewed and change recommendations to say for young women ages 9 to 20, 1 dose is enough. So you can use 1 or 2 doses. Now, if you use 1 dose, you just use 1 dose. For those who want to use a second dose, I always give this qualifier. The recommendations for 2 doses is at least 6 months apart. At least means it could be second dose a year later or even further off. Because, you know, studies which have done bigger differences in between show equally good evidence of protection. What we don't want is the second dose too close. So I've talked to people out there and they say, oh, my daughter delayed the second dose because we haven't yet changed our guidelines, so we're in the process. Should then she restart again? And the answer is absolutely not.
There is an age limit for the HPV vaccine in the country. You could also tell us more about that.
But other parts of the world where they have more resources, routine vaccine goes up to the age 30, and even older women benefit from vaccination. But the data we have for single dose, the trials that were done were up to age 20. That's why the recommendation starts there. Then for the older groups, we do 2 doses.
Do you still have to go for screening?
Oh yes. So I say there are about 15 high-risk HPV types that cause cervical cancer, and actually cause all HPV-related cancers. And I think what I didn't say to you is that evidence has shown that 5% of all cancers are related to HPV. So that's a power of vaccine, because you prevent 5% of all cancers. That's huge. Once you're vaccinated, you're protected from the vaccine type HPVs. So like the bivalent vaccine has HPV 16 and 18, which cause 70% of cancers. So then you have this other 12. So you're still running some risk. Yeah, so you still need to continue screening, perhaps not as often.
Cervical cancer and now HPV vaccine seems to be very close to your heart. Why cervical cancer? Why is it so important for you to, work in this area and to help the women?
When you see the ravage that cervical cancer does to women and their families, and when you know that it's a disease that need not happen, we have all the knowledge there is and the tools to protect women from this cancer. So our inability to deliver is a pain. So, this opportunity to speak about it and, spread the gospel, as it were, and hopefully touch other people so that they get the prevention services that are available.
What is the impact of cervical cancer on women? Having worked as a gynecologist, you must have witnessed what women go through. Maybe you could paint a picture for us.
The estimate in Kenya is that 9 women die every single day with cervical cancer, and I think that's horrendous. It's a small matatu, right? Now you translate that to 7 days. What's 9 times 7? That's 63 women in a week who need not have died. Because what cancer does is your normal cells grow and outgrow. They proliferate, grow really, really fast, Imagine like when your tea is boiling and it just flames up. And that growth overwhelms the blood supply, so tissues begin to rot and fall off. And then they break off and bleeding happens. So the cervix is the mouth of the uterus. Well, you say the uterus is like, it's a womb, it's like a pot, right? And it has a mouth. So right there at the mouth of the uterus is where the infection happens and cancer happens. And because it's hidden, most people don't know they have it until it's late, until they have symptoms. It's a slow disease. It takes up to 10 years with abnormal changes. This is where prevention comes in, because it has this 10-year period where we have tools to detect it with fairly simple tests. And we can say, but she feels nothing, and when you look, you see nothing, everything's healthy. So we have this period where we can screen women and prevent cancer. So by the time she's coming with those signs and symptoms, it's late. But the thing about cervical cancer is if we even detect early disease and we remove the cervix and the uterus, it's curable. So you see, it gives us so many opportunities to make a difference for it not to happen.
The loss of a mother has profound effects, on the family. Maybe you could emphasize for us why it is very important for women and even men to just, collaborate or at least help each other in terms of identifying or at least supporting the women to go for, cancer screening or cervical cancer screening for that matter.
So remember, these are women who are running homes. They are mothers, they are wives, they are caregivers. As we grow older, we also have grandparents, parents, children. They are matriarchs in the homestead. So we often think of disease on direct impact, like what it does to her, but I think we also lose the part of what the impact of society when a woman dies in a home. So the investment in protecting women's lives is huge.
And after all is said and done, prevention is always better than cure. So on our good practice today, we feature Dr. Sivaram. He is a cancer surgeon. He'll be telling us some of the healthy tips that we need to, adapt for a healthy lifestyle and definitely to prevent cancer.
How carbohydrates can trigger cancer is If you are taking more carbohydrate load, your body's insulin levels are going to be high, and insulin resistance is going to be there. Insulin is something that causes growth factor. It's a positive growth factor, and a lot of cancers are driven by this insulin-like stimulus. And furthermore, it's very interesting to know that cancer cells can survive only on glucose. They cannot survive on fats. Whereas the human body is like a hybrid mechanism. It can survive on fat or it can survive on glucose also. No other mammalian species drinks milk from another species, not from another mother even. And no mammal takes milk as an adult after growing teeth. So man violates these fundamental principles. And milk has a lot of, again, peptides and proteins in them. So not just cancer, a lot of this autoimmune disorders could be, and some GI diseases could be milk-based. So moving to a plant-based milk improves the health for many people. This is again not been actually proven or implicated, but it could potentially be a reason. Now, any amount of meat, more than 150 grams per week, say give an allowance and give it to 200 grams per week, more than that, consumption is going to be increasing the cancer risk. We know that one of the prime reasons for having cancer, apart from tobacco and alcohol and other infective process, is lack of a good physical routine. Adults need to have 300 minutes of moderate intensity aerobic activity per week. Be open to the possibility of screening, because the single most positive way that you have to in this fight against cancer is to screen yourself against possible diseases. When I speak about Kenya, we also see a lot of patients with elevated family history of prostate cancer. They could be starting screening with a simple blood test, serum PSA, annually from age 55. And women should have cervical cancer vaccine if possible, as before being sexually active, or if not, they should be on a regular Pap smear and DNA-based screening tests are available annually. Those can be done. Never fear. So if you fear kills kills you more than cancer. So anybody confused, anybody in fear, distress is less likely to make right decisions about treatment. Seek and learn about the disease in hand and participate in the treatment decision making at a very early stage. Just because you got cancer, don't stop working out. If you are an outdoor person, do continue all your routine activities. Don't become a patient. Don't be bedbound, because that is going to further decrease your prospects of getting better. And smile, because all smiles, I've seen in general, when you look at, often we want to see the patient. We don't just assess the health, but also the emotional or the mental health, which I think is very important, very vital. We talk about 3 healths which need to be optimized: the physical health, the mental health, and also the economic health. That is where the family comes in. Yeah. You should not be strained for resources for doing the right things.
Well, that's where we end the program today. Thank you so much, as usual, for making time to be with us on Health and Lifestyle. We hope to see you again in our next program. But remember, our social media platforms are open at KBC Channel 1, at Mariambo on Twitter, and also on our Facebook, that is KBC Channel 1 TV. Share with us some of the topics that you'd want us to feature in this program. My name is Mariambo, and hope to see you again next time.